The annual U.S. suicide rate increased by 24% between 1999 and 2014. In 2016, the American suicide rate was the highest that it had been in 28 years. The suicide rate among young people is steadily increasing. According to a 2017 CDC report, suicide was the second leading cause of death for individuals between the age of 10 and 34. 18.5% of veterans who served in either Iraq or Afghanistan have suffered from depression or PTSD. Only half who need treatment for their mental health conditions seek it. A survey found that many former military service members fear negative consequences associated with seeking mental health care, such as coworkers losing confidence in them, medications having too many side effects, or jeopardizing current and future security clearances. Many people aren't getting treatment or aren't insured. Only 28.2% of young adults who have experienced a major depressive episode in the past year are receiving consistent treatment. However, 59% of youths with major depression do not receive any help, and 10.3% of adults with mental illness are uninsured. There are gaps in insurance plans for mental health care services. Many insurance policies do not cover mental health care services. With wide variances in state-by-state coverage, many states in the South have relatively low access to care compared to other regions in the United States. A mental health reform law passed in the House with overwhelming bipartisan support. In 2016, the House passed H.R. 2646, Helping Families in Mental Health Crisis Act of 2016. It received 207 co-sponsors from both Democratic and Republican members of Congress. It included funding for mental health care services in various federal health programs and expands suicide prevention efforts to all ages.